Hey viewers, welcome to another goodies video. Have you been taking care of your heart? Your cardiovascular health is crucial to the rest of your body. While heart attacks often seem like they come out of nowhere, there are many warning signs that you should look out for. Is sweating one of them? Is slurred speech one? Are you feeling lightheaded? How about shortness of breath? Let's talk about 10 signs that you're going to have a heart attack soon. Blood vessels that deliver blood away from the heart are referred as arteries. Most of the body's arteries carry oxygen and nutrient-rich blood to major organs, structures, and tissues. Arteries, like pipes in your home or car, can become clogged. Atherosclerosis is a condition in which plaque builds up in the arteries, causing them to become clogged. Plaque is a compound made up of fat, cholesterol, and other compounds in the blood. Plaque builds up and hardens over time, resulting in a narrowing of the arteries. The arteries narrowing, or clogging, can have serious consequences for the body and health. The early stages of plaque development in the arteries, known as atherosclerosis, are usually asymptomatic, or without visible symptoms. Individuals may experience a variety of indications and symptoms as the disease worsens, which could indicate clogged arteries. Before we begin this video, don't forget to subscribe to our channel for more similar videos, and turn on notifications so you never miss our new videos. 1. Chest pain or pressure. Chest pain or pressure can indicate a cardiac artery blockage. The heart is a muscular organ that is constantly beating in order to supply the body with fresh blood. This blood carries oxygen and nutrients to all parts of the body, which is necessary for sustaining life. People may experience chest pain as a symptom when the arteries to the heart become considerably obstructed, as the heart muscle does not receive enough oxygen to perform its function. In men, chest pain is the most prevalent sign of a heart attack. 2. Shortness of breath. Women who are having a panic attack, also known as a myocardial infarction, often don't have chest pain, but they often exhibit shortness of breath. This feeling is thought to be caused by the heart's reduced capacity to fill and empty, resulting in increased pressure in the blood vessels in and around the lungs. The flow of blood through the heart could become impaired if the heart begins to fail in its function of efficiently pumping blood throughout the body, leading to blood backup in the lungs, which causes shortness of breath. This form of heart failure is often due to damage to the heart muscle because of clogged arteries to the heart. 3. Fatigue. People could become tired as a consequence of heart failure caused by clogged arteries. This is another important indicator of heart disease in women, along with difficult breathing. The heart will begin to work harder if it does not receive enough oxygen to accomplish its function. Excessive exhaustion can result from the increased workload on the heart. 4. Indigestion. Indigestion, or the sense of a burning sensation in the chest, is sometimes misdiagnosed as acid reflux, or a digestive ailment. In women, however, this sensation is commonly a symptom of heart disease or a heart attack. Antacids can help with heartburn that develops after a meal. If the sensation persists after taking antacids, it could be a sign of a heart attack, especially in women. One theory for the pain is that it is due to a lack of blood flow caused by atherosclerosis, which makes the heart to work harder while beating. 5. Excessive sweating. Individuals with heart disease can often experience a feeling of profuse sweating, diaphoresis, that seems to be out of the ordinary. This could be related to the heart's higher exertion, as it tries to execute its job in the face of clogged arteries. During this moment of increased work, the body sweats to keep its temperature down. 6. Leg ache. After walking for a while, the discomfort is described as an aching, throbbing, or burning sensation that subsides after a short period of rest. Claudication is the medical term for this type of pain. Claudication occurs when there is a shortage of blood flow to the leg muscles, while walking or exercising. Again, atherosclerosis, or artery clogging, could be the reason for the low blood flow. 7. Slurred speech. Slurred speech is a symptom characterized by poor pronunciation of words, mumbling, or a change in speed or rhythm during talking. People can suffer such symptoms of a stroke when the arteries supplying blood to the brain become clogged due to atherosclerosis. Symptoms include weakness on one side of the body, drooping of the face, slurred speech, and memory and thinking. 8. Light-headedness. The feeling of dizziness or light-headedness, as if one is about to pass out, or the act of passing out, could indicate clogged arteries. Syncope, or the loss of consciousness for a short period of time, is mainly caused by a shortage of blood supply to the brain. When the arteries leading to the brain, the carotids, get clogged, this can happen. It can also occur in a condition known as aortic stenosis, in which a valve in the body's largest artery, the aortic valve, becomes heavily clogged as a result of the same atherosclerosis process that occurs in the body's minor arteries. The clogged valve prevents blood from freely flowing out of the heart and into the brain and the rest of the body. The shortage of oxygenated blood in the brain can lead to a fainting spell. 9. Erectile dysfunction. In men, erectile dysfunction is a common symptom of coronary artery disease. The process of atherosclerosis, which has previously been mentioned as occurring in the small arteries that feed the heart, can also occur in the small arteries that feed the penis. Healthy blood flow into and out of the penis supports normal erectile function. Erectile dysfunction occurs when the flow of blood into the penis is disrupted. Erectile dysfunction is generally the first sign of heart disease, which is defined as a malfunction of the blood vessels that prevents them from opening properly. 10. No symptom. Although clogged arteries can cause one of several symptoms, the earliest signs and symptoms are non-existent. In fact, when a patient starts to have symptoms of clogged arteries, it's usually a sign of advanced disease. Life-threatening complications of clogged arteries. Atherosclerosis, which is a major contributor to cardiovascular disease, is the leading cause of death worldwide. A heart attack or myocardial infarction can occur as a result of clogged arteries damaging the heart. This occurs when the heart does not receive enough blood flow to provide the oxygen required to keep the cardiac muscle alive and healthy. These attacks can develop in different sections of the body due to a shortage of blood supply. A stroke occurs when the arteries supplying oxygenated blood to the brain become severely blocked. So before ending this video, let's summarize. Blood vessels that convey oxygen-rich blood throughout the body are called as arteries. When atherosclerosis, or artery blockage, begins, the flow of blood via the arteries might be hampered. Atherosclerosis can cause a wide range of symptoms in people. Light-headedness, dyspepsia, erectile dysfunction, and chest pain are among the symptoms that can be experienced. If you or someone you know is experiencing these symptoms, it could be a sign of heart disease, and you should get medical attention. Enjoyed this video? Hit the like button and subscribe to our channel for more videos like this. Thanks for watching. Live beautifully. Be strong and healthy.